Hi class, my name is Sumaya and I'm presenting today hyperthyroidism. Hyperthyroidism is a clinical syndrome characterized by increased metabolic rate, serum thyroxine T4 and or free T3. The most common cause of excessive production of thyroid hormone in the United States are Graves' disease, toxic multinodular goiter, painless or silent thyroiditis, and toxic adenoma. Patient with hyperthyroidism present with a clinical manifestation of hyperthyroidism but might have different pathological feature. For example, patient with a Graves' disease and toxic adenoma might present with similar clinical manifestation, but the pathophysiology for both these conditions are completely different. In Graves' disease, the patient developed autoantibody against thyroid stimulating receptors, which cause increased overstimulation of the thyroid stimulating hormone receptor and cause increased synthesis of the thyroid hormone. In America, this condition called Graves' disease, and in Europe, it's called Pasido disease. The disease occurs most commonly in young women and characterized by increase in the thyroid gland with a smooth capsule and increased vascularity. In case of toxic adenoma, the thyroid gland enlarge with multiple nodules of different sizes. These nodules produce more thyroid hormone, which suppress the release of the thyroid stimulating hormone from the pituitary gland. It is caused because of somatic mutation in the thyroid stimulating hormone receptor or GS-alpha gene in the thyroid nodule. These conditions occur more commonly for older male and female. The clinical manifestation of toxic adenoma are different from usual hyperthyroidism. In this condition, the patient presented with cardiac manifestation, such as atrial fibrillation. So that is the cause, this condition called apathic hyperthyroidism. In case of toxic multinodular goiter, it affects more older person who lives in iodine deficient area. Over time, nodule arise because of the frequent replication of the clonogenic cell that lead to the somatic activating mutation of thyroid stimulating hormone receptor. Painless or a transient thyroiditis, it is autoimmune disorder. It happened because of it can cause distraction of the thyroid gland, leading to release of the performed thyroid hormone into the blood circulation. There is also drugs which can stimulate overproduction of the thyroid hormone, or it can cause release of the performed thyroid hormone into the blood circulation, such as amiodarone, interleukin, lithium, and interferon. Hyperthyroidism, it can be secondary if the problem occur in the pituitary gland, like for example, tumors affect the pituitary gland, lead to the oversecretion of the thyroid stimulating hormone, which can cause hyperthyroidism, or it can be tertiary because of the problem affecting the hypothalamus itself. Gestational trophoblastic disease and hyperemesis gravidarium. These conditions also occur because both conditions can increase the secretion of the beta-human chorionic gonadotropin. The beta-human chorionic gonadotropin, it is similar chemically to the thyroid stimulating hormone, which cause overstimulation to the thyroid gland and produce more thyroid hormone. Subacute granulomatous thyroiditis. This is a viral infection, cause inflammation in the thyroid gland, can cause painful swelling, and produce destruction of the thyroid cell and release the performed thyroid hormone into the circulation. There are several risk factors for hyperthyroidism, such as females. Being a female, it can be also a risk factor, personal or family history of autoimmune disorder, viral infection, living in area with iodine, living in area that has iodine deficiency, or tumors. The major sign and symptoms, it is because of hypermetabolism, which is palpitation, heat intolerance, diaphoresis, tremor, lead lag, diarrhea, weight loss, despite increase in the appetite, muscle weakness, especially the proximal muscle, sometimes also because of the hyper metabolism that can affect the heart and cause atrial fibrillation and heart failure. The pathogenomic sign of a Graves' disease is the exophthalmos and the preorbital edema. Patients with hyperthyroidism can develop complication called thyroid storm, which is similar manifestation of hyperthyroidism, but it is severe. Like in hyperthyroidism, the patient can have like a hot feeling or heat intolerance, but in case of thyroid storm, the patient can develop a fever. So a thyroid storm happens if the patient stop taking medication all of a sudden, or develop infection, or went for surgery. In this condition, the thyroid glands secrete the perform thyroid hormone into the circulation in large quantity, so that cause life-threatening condition to the patient, which need to be addressed immediately. The diagnostic test, it include thyroid stimulating hormone, which is free. It includes thyroid stimulating hormone, free thyroxine T4, and the T3 level. Also, serum level of thyroid stimulating immunoglobulin can be done. Also, which can help to distinguish Graves' disease from the other cause of hyperthyroidism, and also radioactive iodine uptake and the thyroid scan also can be performed as a diagnostic test. Thank you so much for watching.